He thought he was doing everything right. After his stage 3 kidney diagnosis, he loaded up on healthy foods, fresh fruit every morning, smoothies packed with bananas, oranges, and dried apricots. His goal? Heal naturally. But within weeks, his blood pressure spiked, his legs began to swell, and his potassium levels shot dangerously high. His nephrologist took one look at his lab results and asked, "What exactly have you been eating?" What he didn't know was that not all fruits are kidney-friendly, and some, though healthy for others, are a silent danger for people with CKD. The very fruits he believed were healing him were pushing his kidneys closer to failure. Now compare that to another patient, same stage of CKD, but with a different approach. She carefully selected fruits low in potassium and phosphorus, ones known to reduce inflammation and support gut health. Within months, her creatinine levels stabilized, the bloating went down, and she felt more energetic than she had in years. The difference? It wasn't medication, it was the right fruit, in the right amounts. Today, we'll reveal 6 fruits silently damaging your kidneys, and 4 that can help cleanse and protect them. And fruit number 3 on the safe list? Most doctors never mention it, but it might be the one thing keeping your kidneys from slipping further. Most people grow up hearing that fruit is the healthiest thing you can eat. And for many people, that's true. Fruits are packed with vitamins, fiber, antioxidants, and hydration. But when it comes to chronic kidney disease, this advice becomes a dangerous oversimplification. Because here's the truth, not all fruits are safe for CKD patients. Some fruits contain sky-high levels of potassium, which healthy kidneys can filter out easily. But damaged kidneys? They struggle. When potassium builds up in your blood, it can lead to irregular heartbeat, muscle weakness, and even sudden cardiac arrest. And the scary part? You often won't feel the danger until it's too late. Then there's fructose, fruit sugar. In small amounts, it's fine, but in excess, it increases insulin resistance, worsens inflammation, and has been linked to the progression of kidney damage. Fruits high in oxalates can also contribute to kidney stones, while others hide phosphorus in forms that quickly overwhelm your system. And yet, the myth persists. If it's fruit, it must be healthy. That logic works in general nutrition, but it can be deadly in kidney care. CKD isn't just about eating clean, it's about eating smart. The goal isn't to cut fruit out completely, it's to know which ones support your kidneys and which ones silently sabotage them. Because the wrong fruit can spike your labs, but the right one can actually help lower inflammation, support digestion, and even improve filtration. So in the next few minutes, we're going to break the myth wide open. You'll learn exactly which fruits to avoid, and which ones your kidneys will actually thank you for. This could be the shift that changes your numbers and your future. Let's break a dangerous illusion wide open. Not all fruits are safe for your kidneys. In fact, some of the most commonly recommended healthy fruits are secretly toxic landmines for people with chronic kidney disease. You might be eating them every day, thinking you're doing the right thing, while your potassium levels climb, your blood pressure spikes, and your kidneys silently suffer. Here are 6 fruits that kidney patients should avoid at all costs, and why. 1. Bananas. The potassium king. Bananas are often seen as the poster child for healthy snacking, but for CKD patients, they're a potassium bomb. Just one medium banana contains 400 to 450 milligallons of potassium, and most patients don't stop at 1. With impaired kidneys, your body can't efficiently remove this mineral, leading to hyperkalemia, which can trigger irregular heartbeat or even heart failure. What seems like a harmless breakfast choice could land you in the ER. 2. Oranges and orange juice. Liquid trouble. Oranges are another fruit with a healthy image, but they're packed with potassium, around 250 to 300 millimol per fruit. But the real danger? Orange juice. Just 1 cup can deliver 500 milligrams of potassium, and because it's a liquid, it hits your system fast. No fiber to slow it down. No satiety to stop you from drinking more. It's easy to down multiple servings and unknowingly send your potassium levels soaring. 3. Avocados. Healthy fat, deadly mineral. Yes, avocados are rich in healthy fats. Yes, they're great for the heart. But here's the catch. They're one of the highest potassium fruits on the planet. A single avocado can pack over 900 milligrams of potassium, more than double what many CKD patients should get in an entire meal. Even just a few slices on toast can push your numbers into danger territory. 4. Tomatoes. Acid plus potassium. Combo. Tomatoes often get overlooked as a fruit, but biologically they are, and nutritionally, they're trouble for kidneys. They're not just high in potassium, around 290 milligrams per medium tomato. They're also highly acidic, which can irritate the digestive tract and contribute to metabolic acidosis, a condition common in CKD that further weakens kidney function. Tomato sauce, paste and juice? Even worse, concentrated forms that deliver even more potassium per bite. 5. Dried fruits. Sugar and potassium on steroids. Raisins, apricots, prunes. They sound healthy, but don't let their size fool you. Dried fruits are concentrated versions of their fresh counterparts, meaning their sugar and potassium levels are sky-high per serving. Just half a cup of dried apricots can contain over 750 milligrams of potassium, and most people eat more than that in one sitting. Add to that the high sugar content, which worsens insulin resistance and inflammation, and you've got a dangerous cocktail for CKD. 6. Pomegranates. Hidden danger in a superfood. Pomegranates are often hailed as a superfood, loaded with antioxidants, heart benefits, and immune support. But for kidney patients, they're a stealth threat. One medium pomegranate contains around 400 milligrams of potassium, and also delivers a solid dose of phosphorus, which is often not labeled, but still present. What's worse? Many drink pomegranate juice, thinking it's a healthy choice, not realizing it delivers potassium in liquid form, with no fiber to slow absorption. Overconsumption is common, and the risk is real. Here's the truth most people don't hear. These fruits may be healthy for the average person, but not for someone with kidney disease. Your kidneys can't process the excess potassium, sugar, acid, or phosphorus, and these fruits quietly push you closer to dangerous territory. But this isn't about fear, it's about clarity. Because just like there are fruits to avoid, there are also fruits that can support your kidneys, reduce inflammation, and help stabilize your lab numbers. And that's what we're revealing next. 4 fruits your kidneys will actually love, and why most people completely overlook. 3. Now that we've uncovered the fruits that could be quietly sabotaging your kidneys, let's shift gears, because this isn't about giving up fruit altogether. It's about knowing which fruits help your kidneys heal instead of hurt them. The right fruits can provide anti-inflammatory compounds, antioxidants, and gentle hydration, all without burdening your kidneys. Here are 4 fruits your kidneys will actually love and exactly how to use them safely. 1. Apples, the gut-kidney protector. There's a reason the old saying goes, "An apple a day keeps the doctor away." For kidney patients, apples are one of the safest and most beneficial fruits you can eat. They're low in potassium, just around 150 milliordents per medium apple, and packed with soluble fiber that helps reduce cholesterol, support gut health, and bind with tauins in the intestines so your kidneys don't have to work as hard. Apples also contain quercetin, a powerful anti-inflammatory compound shown to protect kidney cells from oxidative stress, and because they're high in water, they contribute to hydration without flooding your system. How to eat it. Enjoy it raw with skin for max fiber. Bake it with cinnamon for a kidney-safe dessert. Slice into salads or oatmeal for variety. With apples, the flavor is sweet, the texture is satisfying, and the kidney impact is minimal. 2. Blueberries. Tiny but powerful. Kidney shields. Blueberries may be small, but they deliver big protection. These berries are low in potassium, about 114 milligallons per half cup, and contain anthocyanins, the antioxidants responsible for their deep blue color. Anthocyanins help protect kidney cells from oxidative stress, reduce inflammation, and may even slow down CKD progression. Plus, blueberries support brain health, gut balance, and blood sugar control, 3 systems closely tied to kidney function. How to eat it. Sprinkle on cereal or oatmeal. Blend into a smoothie with egg whites or tofu. Enjoy frozen as a cool, low-risk snack. Fresh or frozen, blueberries belong in every CKD diet. 3. Pineapple. The low-potassium tropical surprise. Most tropical fruits are off limits for CKD patients due to their potassium content. But pineapple breaks the rule. It's not only low in potassium, about 180 milligallons per half cup, but also contains bromelain, an enzyme that aids digestion and reduces inflammation throughout the body. Bromelain has been studied for its ability to ease joint pain, improve circulation, and even help break down excess protein waste, taking pressure off your kidneys. Myth check. Isn't pineapple too acidic? In reality, while pineapple tastes acidic, its post-digestive effect on the body is alkalizing, which helps neutralize acid buildup, a common issue for CKD patients. How to eat it. Fresh chunks as a snack or side, blended into smoothies, grilled lightly with cinnamon as a dessert. Pineapple gives you that sweet tropical feel without the kidney backlash. 4. Red grapes. Anti-inflammatory and hydrating. Red grapes do more than satisfy your sweet tooth. They're packed with resveratrol, a natural antioxidant that helps reduce inflammation and oxidative stress in the kidneys. They're also low in potassium, about 150 milligrams per 1/2 cup, and high in water content, which helps you stay hydrated and support regular detoxification. Myth check. Aren't grapes too sugary? Not really. In moderation, the natural sugar in grapes is balanced by fiber, antioxidants, and water, making them a better option than many fruit juices or high-sugar snacks. How to eat it. Enjoy raw and chilled. Freeze for a crunchy, sweet treat. Mix into a salad with apples and lemon juice. Grapes are easy, refreshing, and carry more health benefits than most people realize. So there you have it. 4 fruits your kidneys will love. Apples for fiber and anti-inflammatory support. Blueberries for antioxidant protection. Pineapple for digestion and gentle sweetness. red grapes for hydration, and kidney-calming resveratrol. These aren't just safe options, they're functional foods, actively working to support kidney health, reduce inflammation, and keep your body in balance. You don't have to fear fruit. You just have to choose smartly. Because the right fruit can cleanse, nourish, and protect your kidneys, one bite at a time. When it comes to kidney health, the wrong fruits can do serious damage, and fast. The danger doesn't always come from what you expect. Many of these fruits carry hidden risks that silently raise your lab numbers while you think you're making healthy choices. Let's start with potassium. In healthy people, excess potassium gets filtered out by the kidneys without issue. But in CKD patients, that function slows down. The result? Potassium builds up in your blood, leading to hyperkalemia, a condition that causes irregular heartbeats, muscle weakness, and in severe cases, sudden cardiac arrest. Fruits like bananas, oranges, and avocados are loaded with potassium and can push you into dangerous territory with just one serving too many. Then there's sugar, specifically fructose. Found naturally in fruit, fructose becomes a problem when consumed in high amounts, especially from juices or dried fruits. Studies show that high fructose intake increases insulin resistance, worsens inflammation, and raises uric acid levels, which directly stress the kidneys. Over time, this leads to faster GFR decline and a higher risk of developing complications like gout or metabolic syndrome. And dried fruits? They're one of the most misleading foods in a CKD diet. Raisins, apricots, and prunes may seem innocent, but they're basically condensed potassium, sugar, and phosphorus in every bite. A handful might seem small, but it delivers more potassium than your kidneys can safely handle without any water or fiber to balance the load. These wrong fruit choices don't just spike one number, they throw your entire system off. They increase urea levels, elevate creatinine, and lead to fluid retention, which causes swelling, shortness of breath, and high blood pressure. So yes, fruit can help or harm. The difference lies in knowing what your kidneys can actually handle. And when you make the right choices, your GFR stabilizes, your symptoms improve, and your kidneys get the relief they desperately need. If you're living with kidney disease, the goal isn't to avoid fruit, it's to use it wisely. That's where a smart fruit strategy comes in. It's not just about what you eat, but how, when, and how much. First, let's talk about portion control. Even kidney-safe fruits, like apples and blueberries, can cause problems if you overdo it. The key is to stick with 1/2 cup to 1 cup servings, depending on your potassium limits and stage of CKD. More doesn't mean better, it just means more for your kidneys to process. Next, try to pair your fruit with fiber or protein. This slows down digestion, prevents sugar spikes, and reduces strain on your kidneys. For example, have blueberries with plain Greek yogurt or sliced apples with a few unsalted almonds. This combo supports gut health and helps keep your metabolism stable. Also, don't eat all your fruit at once. Spreading your servings across the day gives your kidneys time to filter waste gradually, instead of overwhelming them in one meal. Here's a sample low-risk fruit schedule for someone in stage 3 to 4. CKD. Breakfast. 1/2 apple with a slice of white toast and egg whites. Mid-morning snack. 1/2 cup blueberries with a sprinkle of ground flaxseed. Lunch. Grilled white fish with a small side of red grapes. 1/2 cup. Evening snack. A few pineapple chunks with cinnamon or plain yogurt. that gives you 2 cups of fruit total, hydrating, anti-inflammatory, and kidney-safe, without potassium overload. Remember, smart eating isn't about restriction, it's about precision. When you understand how to structure your fruit intake, you can enjoy the flavor and health benefits without risking your lab numbers. Small portions, smart pairings, and daily balance. That's how fruit becomes your ally, not your enemy. There's no shortage of bad advice out there when it comes to fruit and kidney disease. Let's break down the 4 most dangerous fruit myths that are quietly harming CKD patients every single day. Myth number 1. All fruits are healthy. This is the most common and the most harmful. While fruits are full of nutrients, not all of them are safe for damaged kidneys. Many are high in potassium, phosphorus, or sugar, which your body simply can't process effectively in later stages of CKD. Bananas, oranges, avocados. They may be healthy for most people, but for kidney patients, they can be toxic in the wrong amounts. Myth number 2. Juicing is better than whole fruit. Wrong. When you juice a fruit, you strip away the fiber and concentrate the sugars. You also make it easier to consume much more than you would in whole form. A glass of orange juice might take 4 oranges to make, and that's 1,000 plus millimoles of potassium in one drink. With no fiber to slow absorption, your blood sugar and potassium spike instantly, which puts enormous pressure on your kidneys. Myth number 3. Sugar from fruit doesn't count. It absolutely does. Fructose, the natural sugar in fruit, is still a simple sugar, and in high amounts it raises insulin resistance, contributes to fat buildup around organs, and promotes inflammation, all of which accelerate kidney damage. Yes, it's better than processed sugar, but no, it's not free from consequences. Myth number 4. Dried fruits are harmless because they're natural. Dried fruits are dangerously concentrated. With water removed, you're getting high doses of potassium, sugar, and even phosphorus in tiny bites. Just a handful of dried apricots can push you over your daily potassium limit. Don't fall for the hype. In CKD, fruit isn't always friendly. When you know the truth, you can make better choices, and that's what keeps your kidneys safer longer. Let's take a moment to reflect on what you've just learned, because this knowledge can change everything. We exposed 6 fruits you should avoid at all costs if you have kidney disease. Bananas, oranges, avocados, tomatoes, dried fruits, and pomegranates. These may seem healthy, but for someone with CKD, they're often loaded with potassium, sugar, acid, or phosphorus that your kidneys simply can't handle. Then we revealed 4 fruits your kidneys will love: apples, blueberries, pineapple, and red grapes. These are low in potassium, high in antioxidants, and gentle enough to support kidney function without overloading your system. So the next time you reach into the fruit basket, remember, it's not just about what tastes good or seems healthy. It's about what your kidneys can safely process. The right fruit can cleanse, nourish, and protect your body. The wrong fruit can slowly push you toward dialysis. Because the truth is this: your kidneys don't need all fruit. They need the right fruit. Now it's your turn. Which fruit surprised you the most? Drop your answer in the comments below. And if this video gave you clarity or a dose of hope like it, subscribe for more and share it with someone managing CKD before it's too late. One bite at a time, one choice at a time, you can change your future. Starting today.